Hi, I'm Dr. Liza Capiendo.
I'm Dr. Iman Faruzmand.
And I'm Dr. Gary Hoffman. We are colon and rectal surgeons with Los Angeles Colon and Rectal Surgical Associates in Beverly Hills, California, and at Cedars-Sinai Medical Center. Let's talk about the stages of colon cancer, and let's talk about why those stages are relevant and what they mean. But before we go into it, I want to remind you, these numbers that everybody talks about, how long will I live if I have colon cancer, they're all over the internet, and you can look them up. And I don't discourage people from looking them up because they're just statistics. And statistics may take a look at 1,000 people and say X number of them are going to live X number of years. Well, what good is that to you? We don't know. So you can look up something, but you might look it up and it might depress you, or it might make you feel happy. But what does it have to do with you? And the answer is nothing. We don't know until down the road, time will tell. So let's talk about those stages. What are they and what do they mean? There are 4 stages of colon cancer. What are they based on? They're based on a system we call TNM. T, for the most part, is tumor thickness, although in anal cancer, it's tumor size. N, lymph node status. Do you have lymph nodes involved in the specimen or not? And M is metastatic disease. Has it traveled anywhere? TNM. And when you look at the yes or no answers to each of these TNM categories, those get combined and you come up with the stage. And the stage determines what we're going to do as far as further treatment or not. So let's look at T stage, tumor thickness. I'm not going to go into the various thicknesses, but what I will say is that stage 1 has a tumor thickness that is thinner than the others. Stage 1 has no lymph nodes involved, and stage 1 has no metastatic disease. Stage 2 is similar and exactly like stage 1, except that the tumor is thicker, sometimes being so thick it goes through the colon wall. That would be what's called a T4 lesion. So stage 2 has a thicker tumor with no lymph nodes and no metastatic disease. Stage 3. Stage 3 is the exact same thing as stage 1 and 2, except lymph nodes are involved, and we divide it up even further as to how many lymph nodes are involved. So T has a little subscript, T1 or T2, which we talked about how thick it is. N has a subscript, N1 or N2, and that's how many lymph nodes are involved. And M is still 0, no metastatic disease. And finally, stage 4 involves metastatic disease. You can have a very thin tumor, T1. You can have no lymph nodes, N0, but if you have a liver lesion, it's M1, and it makes you a stage 4 automatically. So putting all this together, what does it do to help the patient? Well, first of all, obviously stage 1, that's great. It's a thin tumor with no lymph nodes and no metastatic disease. And after surgery, generally, unless there are some other very strange and unusual features of the tumor, no further treatment is required. Stage 2 is also not usually treated with any further therapy after surgery. However, depending on some unusual features of the tumor, such as perineural invasion, vascular invasion, tumor budding, or various other pathologic features, many oncologists do want to treat, and that is with good reason. It's when we get to stage 3 and patients ask, "Doc, do I need chemotherapy after surgery?" Most agree, yes, you do. Chemotherapy is associated with a longer 5-year survival when treated. Stage 4 is also treated. It has metastatic disease, and again, we use chemotherapeutic agents which are given either intravenously or orally. Now we're back to the beginning. So you're told, or a patient is told, what stage they have. My advice is you can do some research, but do not be disheartened based on the numbers you see, because these are just numbers. You don't know which number you are. You don't know which group you're in. Go with the flow, go with the treatment, cross your fingers, say a prayer, keep a good smile and a good thought in your heart, talk to your family, live your life, and get through it. Because the fact of the matter is, even if you do look at the statistics, most people get through it, and most people are alive at 5 years. So just go with it, get the treatment, do what your doctors recommend. And that reminds me, don't go for the alternate treatments. Many people say, I've got an alternative treatment. Go with the regular treatment first. If you have to resort to other things, do that down the road. Doctors have your best interest at heart.